There are many possible causes of knee pain, including injury, arthritis, and muscle imbalances. Here are a few tips for relieving knee pain. 1. Rest and elevate your leg. If you've recently injured your knee, it's important to give it time to heal. Try to rest and elevate your leg to reduce swelling. 2. Use ice or heat. Applying ice to your knee can help reduce swelling and numb the area, while heat can be helpful for muscle pain and stiffness. 3. Take over-the-counter pain medications. Non-steroidal anti-inflammatory drugs (NSAIDs) such as ibuprofen or naproxen can help reduce inflammation and pain. 4. Try physical therapy exercises. Strengthening and stretching exercises can help improve flexibility and reduce pain. A physical therapist can recommend specific exercises for your knee pain. 5. Wear supportive shoes. Wearing shoes with good arch support and a cushioned sole can help reduce strain on your knees. If your knee pain is severe or persists despite trying these strategies, it's important to consult with a healthcare provider. They can help diagnose the cause of your pain and recommend a treatment plan.